Hello, everyone. I'm Cynthia Bauer, Director of the Horowitz Center for Health Literacy, here to moderate our final session of the 7th Health Literacy in Action Conference. We're very excited for you to be part of this important conversation that we are having today with Dr. Vanessa Simonds, who is an associate professor at Montana State University. And she is going to be talking about a hugely timely topic, environmental health literacy, relationality and place-based knowledge in promoting health and well-being. So we're very excited to welcome Vanessa. I've known her for many years. We share a mentor in common. So I'm very excited to hear what she's got to talk about today. So welcome, Vanessa.
Thank you, Cynthia. So today, I'm going to talk about indigenizing environmental health literacy. Relationality is a central concept in many Indigenous cultures, and this includes this connectedness to family, community, elders, and the land. So we can extend this concept of relationality into an environmental health literacy framework to strengthen our efforts to improve health and well-being. And so today I'm going to talk about a specific example, Guardians of the Living Water, which is an example of an Indigenous-led research partnership that uses an environmental health literacy framework complemented with participatory research approaches. So this partnership is going to highlight the recommendations for promoting equitable environmental health literacy efforts in education and research. And so my goals or objectives for this talk today are to explain why a strength-based approach is important to environmental health literacy efforts, specifically when we're working in Indigenous communities, to describe how these concepts of relationality and place-based knowledge can be applied to environmental health literacy frameworks and our efforts in Indigenous communities. And then how we've applied this indigenized environmental health literacy framework to design, implement, and evaluate these community-level environmental health education and research efforts. And so this first picture here this is the logo for our program. And so it was done by a Crow artist, and it really integrates kind of the most important elements of our project. And so it has these connections to land, the 3 mountains that are important to us, the 2 rivers, the Little Bighorn and the Bighorn rivers. And then the youth are in the middle and the center of this program. And it also has the 4 elements, so earth, water, air, and fire. So while we're meeting today in this virtual platform, I also want to take a moment to acknowledge where we're all coming from and all these lands that we call home. I've been taught how the environment really shapes who we are, and that connection and acknowledgement is important. So these are my mountains in Montana. I live in the valley in the place that's now called Bozeman in Montana. Many Indigenous tribes, including the Apsáalooke, have called this place home for many generations and taken care of it, as well as the Nez Perce, the Lakota, the Blackfeet, the Salish, the Shoshone, and the Northern Cheyenne. These are just some of the Crow names that I've learned recently for this valley, as well as other English translations. One name is the Good Camp. I like that, especially here in the summer. It's the best place to come and camp. So I wanted to center where I come from. I think it's important for me to explain my perspective that I have. I'm a Crow tribal member and a descendant of the Blackfeet Nation, and I'm an academic researcher. As Cynthia said, I was trained by Rima Rudd, and she really has influenced this work that I'm going to talk about today. I also use CBPR approaches. My work has been informed by participatory research, which is where we're integrating and working with the community in all phases of the research process. But we also include an action-oriented aspect of our projects too. Through my work with Indigenous communities, I've also come to understand the importance of Indigenous methodologies and Indigenous approaches to research. And at times I've really grappled with how to integrate Western-based models and research methods that I've been trained in with the Indigenous approaches that I find necessary when working in Indigenous communities. So the project that I'm going to talk about this morning is a partnership with the Crow Nation. The Apsáalooke has a current land base that's located in rural south central Montana. It's about 2 hours from where I live right now and work in Bozeman. It covers 2.3 million acres of our original homelands. It has been whittled away over the years, The border used to just be about 20 minutes from here in Livingston, but now it's 2 hours by Billings. These homelands include the northern end of the Bighorn Mountains, the Wolf Mountains, and the Pryor Mountains. And so those are those mountains I showed you in that first picture. The reservation encompasses these 3 mountain ranges and 2 rivers. These have lots of natural resources that we still use. The tribe shares 64% of its land with Bighorn County, which is the 5th largest county in Montana. It's the largest reservation in Montana and the 5th largest in the nation. It's bordered by the Northern Cheyenne Reservation to the east and Wyoming to the south. The Bighorn and Little Bighorn rivers and Pryor Creek are all tributaries to the Yellowstone River. And these are a vital part of Apsáalooke well-being. These rivers serve as the municipal water sources for 2 of the largest communities on the reservation. We also use well water, so almost at least half of the residents are in rural areas that rely on well water, which I'll talk about a little bit. Apsáalooke people rely on water from these rivers and local springs for ceremonial practices. And so again, as I mentioned, I just wanted to give this overview of CBPR, and all of my work is informed by a participatory research approach. Research has not always been beneficial for Native communities. Sometimes researchers come in, take information, and don't give it back to communities, and even have inflicted harm on communities through stigmatizing research. CBPR also requires action, so research not just for the sake of research. And the research isn't finished until when the data is collected, but it continues as the community partners and the research partners work together to identify solutions. I like this quote: "The intent in CBPR is to transform research from a relationship where researchers act upon community to answer a research question to one where researchers work side by side with the community to define the questions, methods, and implement the research and disseminate the findings and apply them." Okay, so now I want to talk about environmental health literacy and how it can be really strengthened with a community-based participatory approach. And so we may define environmental health literacy generally as this capacity for people to make informed decisions about environmental exposures that may be affecting their health, and then ultimately to engage in actions that address the environmental exposures at both the community and public policy levels. So this is the framework that I've adopted for my own work in Indigenous communities and that I find most compatible with our approaches. And so this is NUTBEAM's 3-level definition of health literacy. So the first level on NUTBEAM's framework is functional literacy. And so this is the level related to the basic definition of health literacy and includes numeracy and reading level. So this is what we think about when we usually think about health literacy. So with functional literacy and accessing health information, we want to think about ensuring that the community has access to clear information about environmental exposures so that they can then make informed decisions. And we want the information to be presented clearly so that it meets the numeracy and literacy levels of the community. And when we think about working with Indigenous communities, we will also want to ensure that the information about environmental exposures is presented in a culturally sensitive manner. So CBPR can be useful when we're designing these information to promote functional literacy because we're partnering with community, and so they can help us to develop appropriate, culturally sensitive health education messages, so that then the material meets the skills and the preferences of the community. The second level of NUTBEAM's framework is interactive literacy. And so this is the more advanced, where the community can actively participate and extract the information and derive meaning from the different forms of communication, and then apply that information to changing circumstances. And so both in CBPR and in environmental health literacy, the goal is for community partners to actively participate and act on information. And then that third level, critical literacy. So this is where the community members critically analyze information and then use this information to exert greater control over life events and situations. And really that's the goal also of CBPR. So to work towards community level social change. And so this framework can really be used to guide us through the development of action plans to address environmental health inequities. So for example, that first level functional literacy might include leaders making that initial connection between environmental contamination and human health threat. And then the next level, interactive literacy, may include community members gathering data. So either them gathering data themselves or working with outside experts to gather data. And then finally, that third level includes the community members using the information to take action and create community level change. And so in my work at CROW, we found that using this framework has really helped us understand where the project is, where it was before, where it is, and then where we're going forward to shape our program. So the framework of EHL was really helpful as I started working out with Indigenous communities, working on these projects. But more recently, I found this other framework, the Indigenous connectedness framework, in the literature, and it really resonated with how we are doing our projects to promote environmental health literacy. And so I think this framework helps us to expand these concepts of environmental health literacy and our efforts to promote environmental health literacy in Indigenous communities. And so this really shows how individual well-being is interrelated with one's family, the community, our intergenerational, so our grandparents, our ancestors, and the next generation. And so this can be central when we're trying to understand how to promote environmental health literacy in Indigenous communities. And so the outer circle here can really show us these mechanisms for creating this connectedness. And so I'll talk about how our program has implemented these different mechanisms. So disparity in access to clean water is a very significant environmental problem. This is a growing problem across the world and an increasing challenge. Rural tribal households are more likely to have issues accessing safe water compared to non-rural households and non-tribal households. And as I mentioned, so some tribal members do have city water or municipal water sources, but many people have to rely on home wells. So this is an area where environmental health literacy is particularly important because well water is not regulated by the state or the government. People have to monitor the safety of their own wells. So they have to know how to get it tested, where to get it tested. When they get the results back, they have to interpret those results and then perhaps to figure out ways to mitigate if there is any contamination. Studies with the Navajo Nation have identified that home wells have been contaminated with uranium and arsenic. At CROW, we have our partners have also collected well water samples as well as natural water sources and have identified some potential contaminants to be concerned. Other studies have indicated that Indigenous people are also more likely to be exposed to contaminated water sources. They're more likely to engage in subsistence lifestyles, as well as to engage in cultural uses of water. Many Indigenous cultures, including the Crow, have a deep spiritual connection to the land, and this includes water sources. So this can impact how water quality risk communication is interpreted. Because while we may have a warning, we may understand our water sources are contaminated, but this could contradict with our spiritual beliefs about the sacredness of water. And this is where that connectedness to environment comes into play. And so we have to think about how we're talking about environmental health risk. It's further complicated in lower income communities that don't have access to resources to address the contamination issues, or perhaps environmental enforcement to address these are challenging. So even if we have water quality concerns, there's limited options to address these issues. Another issue that's unique to tribal nations is jurisdictional issues. And so even though there may be laws designed to promote and protect the environment, the actual enforcement of the laws may not be in place. There could be loopholes in state and federal laws on tribal lands, or maybe tribal lands are seen as not having the regulation compared to other areas. Some studies have shown that companies polluting are more likely to pollute lower income communities because they receive lower monetary penalties as compared to higher income communities. And so these communities that are most likely to be affected by hazardous environmental health exposures have to deal with also these complex jurisdictional issues and lack of resources and inconsistent regulatory enforcement. So through our research and our experiences with community, tribal members have discussed how local water sources have deteriorated over time, and they've talked about how these challenges have affected them. So water insecurity is distressing for any community, but communities that have that connectedness to the water can be particularly distressing. So cultural traditions can be impacted by worsening water quality of the rivers and streams. So as I mentioned, we may hear about the health risks associated with the springs and rivers, but those impacts are weighed against something that's more detrimental to health, and that's losing that relationship to land. Similarly, there's research with the Swinomish tribe. They've talked also about contaminated waters and how that affects their seafood and how important seafood is to their identity. And so to ask them to reduce consumption of seafood is actually even more detrimental to their health. And so when we're talking about these messages, we have to really think about how to portray them in a culturally sensitive manner. So this is a quote that I heard often when I was discussing kind of the central messages of what we're going to teach youth in our programs. So this message is about reciprocity. So taking care of the water because it takes care of us. And so this can be used as a central message as we're kind of promoting environmental awareness in an effort to kind of increase environmental health literacy and to think about what are the actions that we can be taken to address this environmental contamination. So Crow has had these long established academic research community partnerships addressing these water quality issues. Even I think over 2 decades, the Crow Environmental Health Steering Committee was formed to kind of look into these issues of water quality. And so we use this EHL framework, or the Environmental Health Literacy Framework, to illustrate the evolution of our project. And so the first level, it also corresponds with the CBPR principles, where the community identified the issue of priority, which was water quality. And so based on identifying this issue of concern, that second level, interactive literacy, consisted of the community members taking steps to gather data and to understand water quality in the community. So they collected water quality information across the reservation. And then we led to the third level, where our community members were using the information to create community level change. So that another kind of important principle of CBPR is to use that research to take actions that are going to benefit the community. And so members of the Crow Environmental Health Steering Committee expanded their efforts to include the efforts that we're doing with the Crow Environmental Health Steering Committee and developing the Guardians of Living Water project. And so that's when I came in. I had a background in health literacy and Indigenous health, but I hadn't really worked on environmental health. And so by working in partnership with the Crow Environmental Health Steering Committee and new partners at the Tribal College and the Crow Agency Public School, we kind of expanded out this program. And so they kind of started us out with this end goal, which is to inspire youth to be role models and to understand the science of the water quality issues. So this is the way they felt we could impact change in our communities. And so having the youth be the ones inspiring their parents, their friends, and the community. And so using that environmental health literacy framework really helped us to design this program and to think about how we could get youth to that point where they were enacting critical literacy and being agents of change. And so this is the model that we came up with most recently to kind of illustrate how our program works. So this is an indigenized, locally relevant logic model. And it shows how we can transfer of knowledge from Western science and Apsaalga elders. And so when we have people that also bridge both, so Apsaalga scientists who we've interviewed to help inform our project. But they come in and they share their knowledge with, and these are the 3 mountains I talked about before, but they represent our MSU partners. So I have students at MSU that are part of this project, Little Bighorn College interns and high school interns. And so they participate in summer research projects and learning about water quality and cultural knowledge. And then that is shared out, and these are the 2 rivers I mentioned, to the 5th and 6th graders. So this is a summer camp for 2 weeks where they learn about Western science knowledge, water quality research, as well as cultural knowledge. And then that flows out to their family and to the larger Apsáalooke community. And so these are teepees that represent the different clans, the colors for the clans in the Crow community. So in the initial phase of this program, we focus on functional literacy. And so we did this through minor adaptations to Western science-based curricula that teach basic water science. So this is topics like watersheds or the chemical properties of the water cycle. And so really to establish that baseline knowledge of water science. And our goal has always been to integrate Western knowledge with Apsáalooke cultural knowledge. And so community engagement is necessary to really respectfully access place-based knowledge. And so our team worked with our advisory board to identify activities, speakers, places to go that would impact the youth. So we really did include this concept of connectedness. And so one thing that has been emphasized to us is going out on these field trips, going out to the mountains that are important to who the Crow people are, connecting with the land and the places so we could be close to those natural resources that are important to us. Our community advisory board emphasized the power of place, of these culturally significant sources of water. And they explained, so having the youth go visit these places and connect with this land would help them to appreciate the beauty of their homeland and help foster those feelings of environmental responsibility. So for generations, experiential learning has been essential to survival and has strengthened the Apsáalooke's relationship and connectedness to land. We also promoted intergenerational connectedness. So having elders come in each time we go to a different site and share with us about that place and what has happened there and how it got its name. And so we're connecting with our elders, but our elders are also helping us to connect to the land. So our team has conducted interviews with community members following cultural protocols to access knowledge in congruence with these values that we hold highly, like respect, reciprocity, and relationality. Several of the interviewees described this concept of that water is a living being that we need to respect. They also talked about several other concepts that we've included into our program. So since humans have this relationship with plants, animals, and other humans, one thing is when we go out to the land, we only take what we need. We want to save some of the plants for the others. You don't want to take the berries that the bears need. Another concept is that reciprocal relationship that I mentioned earlier. So we take care of the land so it can take care of us. And again, the people that we interviewed, the scientists, Apsáalooke scientists, they talked about, we asked them what had impacted them and influenced them. And they really talked about that generational learning and that experiential learning. So again, that connectedness to elders and that connectedness to the land. So as we moved through this program, we wanted to further center Indigenous values throughout kind of the teachings that we were sharing with the youth. And so one example is the water cycle. And so we started out with a water cycle coloring sheet that had Apsáalooke language labels for the various stages of the water cycle. And so we shared this with our advisory board. And they really liked it, but they suggested, because the one we had didn't include humans or animals, and they suggested that this was really important to emphasize that connectedness of humans and animals to the water cycle. So often Western depictions of the water cycle don't always include animals. And so we discussed and decided to develop a new kind of model. One of our partners developed this coloring sheet over here to kind of really emphasize that relationship that humans have with the land and the animals and the plants. And so also, and you can see these are the contaminants that we can't always see in the water, but that might be there. And so this was an activity designed for the youth to kind of take what they're learning about water quality, what might be in the water, how we're using the water, and they could color it and add words. And this is a way for them to share back what they were learning about water quality research with their parents and their family. So one of the main activities that we do at every stream is the stream bioassessment. And so this is something that scientists actually do to better understand the health of a stream. And so we developed a version for young people. And then we take time, each time we go to a site, we learn from a cultural knowledge holder. And then we also conducted the stream assessment. And this is that first aspect of functional literacy, where we got the basic concepts of doing a stream assessment. And then the students took these and applied them themselves as we conducted and visited each stream and river. And then we adapted it for the spring assessment as well. I just want to show this is a fun activity that many people in science camps use. This is the macroinvertebrates. So you can collect insects from the stream, and it can tell you about the health of the river. So some insects are more tolerant to pollution than others. And so you identify which types of insects are in there. Okay, and this is then we kind of model it first and do some math and count the insects with beads and paper clips that are supposed to represent different types of macroinvertebrates, and have like a healthy stream and a less healthy stream. And so this is always a fun activity. So another expansion of our program beyond water quality research was to understand more about the local plants that are important to the Crow people. And so one plant that's particularly important, and then also one of my students was interested in, is the mint plant, or the shushua. And so we have a local knowledge holder come in, and she shows us, what the mint plant looks like, how it is used for ceremony and everyday practices. We learn about kind of how to identify the plant. We drink some tea. Sometimes it's a little too strong for the kids, so some of them don't like it. And then we incorporate a field trip where we go out. And so every time, and we visit about 6 sites over the 2 weeks. And every time we went this year, we were able to identify and find the mint plant. And so that's kind of that interactive literacy where we're actually applying the knowledge that we're gaining. And so this is a picture of my student who developed this lesson. And so along with learning about the cultural properties of mint and how to identify it, the guardians learned the Western scientific properties. So we learned about the glandular trichomes, and then they were able to look at them under the microscope and identify them. So that was really fun. And so we expanded to also look at the yarrow plant and have one of our traditional knowledge holders take us on a walk and learn about the medicinal properties of this plant and other plants that are around this area, to learn about the animals and our relationship there. Another one of my students she was looking up yarrow, and she developed a lesson because she found out that yarrow plant has antimicrobial properties. And so it can break down the E. coli cells. And so that really related to the E. coli lessons that we focused on with our youth. And so there's a range of water quality issues that we deal with at Crow, but the one that was easiest for us to focus on with the youth and we thought we could test for was E. coli. And so with the 5th and 6th graders, we talk about kind of what E. coli is, where it's found. So it comes from feces, animal feces. And so if we do find it in a water source, then we know that it is polluted by some kind of animal or human. And so kind of talking about how that can also impact us, it can make us sick. And so we learn about how we all have E. coli in our intestines, and sometimes it can make us sick. And so after we have that basic knowledge regarding E. coli, we go out and collect our water samples at each site. And so this is a picture of our youth taking samples at a spring. And so one of the main threads of our program is youth engagement with the research that's going on in their communities. And so as I mentioned, the Crow Environmental Health Steering Committee has many partnerships with researchers who are looking at different potential contaminants in water sources. So we've looked in the rivers, looked in the springs, and do a lot of work with well water. And so sometimes we have researchers actually come in and talk about the research they're doing, and our students can collect samples for the researchers. And we all know that research can take a while for it to be analyzed. So sometimes, and of course it can't happen in just the length of the summer camp. So they come back the next summer, the researchers, and they can talk about how the last year's guardians helped them collect this data and what they found about their water sources. So this really lays the foundation for the students to develop their own research projects and their own hypothesis about water sources that they choose. And so we have students learn scientific method, developing hypotheses, and then they go out and collect their own water samples and then bringing them in, and we prepare the samples. And so we can test for E. coli, and then we can do just some simple water strip testing. And so we teach them a little bit about what those strips can tell us. And this really just provides this basis for interactive and critical literacy elements of the program. And so, as I mentioned, we develop our own research questions, analyze our own water samples, and then we share them with posters and oral presentations. And they've also shared these nationally at conferences and through short films. And so these show last year's, and so we give them a lab coat too, so they can feel like real scientists. And then this is our mentors working with them, developing their project. And so we have the high school and tribal college mentors helping them to design these research posters and then presenting them. And so when we engage youth in these projects, it can help them understand these environmental hazards. And so that's that functional literacy. And then having them present about it increases their confidence in their ability to influence their own health and the health of their community. And we try to show them opportunities where they can make a difference to improve the lives and the health of their community. And so really this idea was proposed by our advisory board to reach the broader community. And after this, we also hold open houses. And so the guardians can go present again to different districts in the community. So I just wanted to go back and revisit these concepts of connectedness and how they can be central when we're thinking about environmental health literacy. So it was always emphasized, as I mentioned, since the beginning of the program, that if we want to have our youth care about the environment, we have to take them out and connect them to them. And so this land is central to our identity as Crow people. And so that is a central part of our messages. It's also always been emphasized since the very first efforts we've had was to share about the history and the stories and the cultural importance of our land and our resources. And so this has always been part of our program. So where the youth are learning the fundamentals of Apsáalooke science and Apsáalooke ways of knowing. And so that's also that functional literacy, I think, too, as well. So that that knowledge about our places. When we're doing these efforts in and with Indigenous communities, that intergenerational connectedness is also central. And so this is one way we can learn about our connection to land and about the responsibilities we have to land and help reinforce those relationships and that connectedness we have to the land. Family connectedness has always been a central part of our program as well. So we originally conceptualized this program as having an interactive literacy component so they gain this knowledge and then they share it with their community, with their family. So taking it home and talking to their family members about it. And so we asked also, before we started, just talking with parents about, is this feasible? Because we want to make sure that kids aren't going home and just sharing messages that wouldn't be appropriate. But we have found this to be effective. And then one way we facilitate this is through a newsletter. And so this kind of shares what we were learning each day, and then we have a take-home activity. So this can help reinforce what we learned that day and help them to talk with their parents and gather more information each day. So the Guardians program is founded upon these values of connectedness across Indigenous communities. And connectedness to the community was reinforced through the Guardians program through these relationships that the youth make with each other, with their mentors, so the high school and tribal college students, with the elders. And so this is really one of the best ideas that our steering committee had for the project. And it helped us also to have them kind of facilitate these science projects too. We found through our work that this is one of the best ways of reaching the youth. These older students learn about water quality and then they teach it to the younger students. And so we wanted to build these interactive literacy skills. And so that really meant improving their personal capacity to kind of extract and apply the information they were learning and to act upon it. And so we also wanted to build several opportunities through the week so that they can practice. Sometimes they haven't had any experience doing presentations. And so we actually get out the microphone and we have them practice with each other before they share with their parents. So the main goal of this project was to develop our youth as agents of change. And so we have used surveys to measure knowledge, so their environmental health knowledge and their self-efficacy. We've also asked them about kind of their attitudes towards a career in science. And then we also do qualitative interviews. And so we ask them kind of what they've learned, what they liked each day. And so these pictures kind of show this is the good and the bad E. coli. So it's kind of the Western concepts that they were learning. And then this other picture shows them feeding the river. And so that's one of the cultural practices that they learned. So we expanded this actually over time, and we have them keep a journal that they get to take home. And they can kind of have their science hypotheses and their project going in there, as well as each day talking about kind of what was a challenge that day or what they learned. And so this one just shows kind of learning about Chief Plenary. So that's the last one of the chiefs, the Crow chiefs, and we go there and there's a spring there. And so we learn about his life and his place and and the spring there. And then we also, as I mentioned, we tell stories. And so water is a central part of the creation story. So this person kind of talked about how she learned about the creation story. And then we do see lots of microscopes. We actually give them a microscope at the end of our camp. And so this is where they were talking about how the microscope was fun to use and to see the mint plant under the microscope. So we have this solid program for developing 5th and 6th graders and getting them interested in research and understanding basic concepts of water quality, as well as the importance of testing and knowing whether water is safe to drink or swim in. And so our next step to take this work further is to build out these activities that we do with the mentors or the high school and college students. So as I mentioned, we do have this water quality research at Crow and data that's been collected on water samples. And so our next step is to work with the high schoolers so they can use the real actual data. And so every year I have students asking me kind of doing projects at school and they want to access the data that we had. But I have to tell them that these are 5th graders and maybe our samples were contaminated. So it's not quite as valid as the data that the researchers collect. And so now we're going to try to kind of help the high school students or college students access that information. And so we're going to integrate this data with mapping tools of the spring sites and then connect them also with the cultural knowledge associated with each site. And so this is going to really focus on data literacy and all 3 levels of the environmental health literacy framework, as well as integrating that environmental or the connectedness to land. And we're taking steps to make sure that the curriculum meets science standards at the high school curriculum. And so making sure we work with the high school teachers to see, what do they have the bandwidth for and how can this be helpful for them. We also want to integrate the Indian Education for All. So this is a Montana constitutional provision and policy that requires public schools to educate their students about the local Indigenous peoples and to preserve cultural heritage. And so this curriculum will meet those Indigenous or Indian Education for All policy requirements. And so we also want this to kind of take that step of critical literacy. And so we have a graduate student who'll be working to identify the springs that have contamination and then do something about it. So fence them off to keep livestock away. And then they can come back and share that with our youth in the summer camps. And so trust is really integral to this process. And this is built with our partners and then expanded through the community. And so sometimes recruitment and retention can require a variety of strategies. we have like multiple obligations, but as we presented this to the community, they always want us to expand it, to make it bigger. And so we work on doing that. We also want to think about the social and political context where we are when we're working with tribal communities to understand tribal sovereignty, acknowledge a history of colonization, and make sure we're aware of stereotypes. So as I mentioned before, research hasn't always been beneficial to our communities. And then also with this, especially with this type of work, this environmental work, we have to think about the complex jurisdictional issues. So when we're thinking about mapping those springs and actually doing something about the springs, we'll have to understand and take those kind of things into account. And then, so just this idea of reciprocity. So this is central to our program, and we want to bring back what we're doing to the community. And so we do that through our presentations and the open houses that we have, where the Crow Environmental Health Steering Committee shares the research they're doing, and guardians are always a part of that process. And so I always think about my responsibility as a researcher working in this community to make sure that we have a program that is valuable, to make sure that it is culturally centered, culturally sensitive, and then ensuring that our program is sustainable. And so we continue to work on that, which sometimes can be a challenge. So CBPR and EHL really emphasize that equitable access to clear communication. Researchers can use both of these frameworks when we're working with communities. They both emphasize like that functional literacy. We recommend close collaboration with community partners so that we can develop these clear messages. Indigenous and rural communities have limited access to STEM opportunities and are underrepresented in STEM fields and college majors. And so by working with the team and working with our community partners and really centering the local Indigenous knowledge, drawing upon Indigenous knowledge holders really helped us to increase the relevance of environmental health literacy efforts. And so, although CBPR is central to the development of our efforts, it also takes time to build trust and to foster that authentic community engagement. And so, but nonetheless, these long-term commitments are rewarded with richer, more credible education and research. And so our research, this is a quote from one of the elders that we've talked with. And so as I've done this work, I'm continually reminded of the power within Aphthalga culture. We're always talking about how everything good can be found there. And all that we need to thrive is in our teachings, in our clan systems, and in our ceremonies, and in those relationships with our family, with our community, with our elders, and with the land. And so I just want to acknowledge my partners, Crow Agency Public School, MSU, consultants and advisors, and our funding has been funded through the Center for American Indian and Rural Health Equity, as well as NSF. And we also are now part of the Center for Braiding Indigenous Knowledge and Science, which is a large center. And then these are my references. So thank you.
So Vanessa, just know that there are so many positive comments in the chat. People really loved everything that you presented. They commented on great way, hands-on way to teach STEM. The persons, they were struck by how interdisciplinary your approach is, by you have, math and art and history and science all integrated together. Someone said, this is a great way to teach, learn, and make needed change. I'm inspired. So very positive comments.
Cool.
There was one question, a lot of interest in the community-based participatory research approach. And so there were two questions about, training community members to collect data and sort of a little bit more about that process, and in terms of trying to establish the reliability and validity of the data in terms of, just, you mentioned that there can be a difference between what the students collect and what researchers would collect. So if you could just say a little bit more about that community engagement and the data collection piece. There were a couple of questions about that.
Yeah, so when we do it, and it's actually going to be used for the research, the researchers come in and they're really like hands-on helping us, like, making sure the kids are, we have our gloves on and all that when we're doing it. And so that kind of helps make sure that data is more valid and reliable. But yeah, I always think when we do it, we do teach them how to like talk about contamination, talk about what's on our hands. We give them gloves to use, teach them how to like use the sterile bottle and rinse it out first with the water that they're going to test. But I never can. We always talk about that too. We talk about how we want to retest if we do find anything, because some people do bring in their samples from their wells, and maybe if we did find E. coli, then we have our partners with the Crow Environmental Health Steering Committee who do a second test of that. And so when they're doing it for the research projects, we're very kind of doing it with them. And then I always do kind of emphasize that we want to do that retest if we do find anything.
Okay. Someone said this was inspiring for a dissertation. So there you go. You're passing it on.
Oh, good.
Yeah. I was just scanning here to see. So just probably have time for maybe one more comment. Someone said, this aspect of connectedness is so important for learning, which is almost always communal. I'm not sure what to do with that for health information, which is usually written and addressed to an individual, right, to be consumed by themselves. And then someone responded, that's true. Maybe we start thinking of family-based health education activity kits for families. So I don't know if you want to kind of comment on that, because you had presented that sort of as a cultural concept. But do you see this kind of maybe applying more generally as something if we're trying to have more impact with health information?
Yeah, I do. I think we can all kind of benefit from those connections to our family, to the community, and to the land. And I think, there are some programs that have done this more with like nutrition advice. So it was started with indigenous communities as well, and they send home kind of the information about healthy eating with the Head Start kids, and then they share it with their families. And so I think it is a way. We can build upon this, and I think everybody kind of needs and wants that connection, and helps learning be more kind of applicable to our lives.
Okay, well, that was a very concise answer, so we have time for a couple more questions. One, do youth participate in other community science projects?
I think this is kind of one, and we want to expand this and to have more students involved. There's other programs with high school students that are more culturally based. So it is Upsalaga science too, like observation and learning about connection to the land and the places. And they're a little bit more brave than I am, going up to the mountains where the bears are and everything. So that is fun, but we don't do that as much. We kind of stay where the bus can take us. But we kind of can train our youth to be part of those programs as they get older. But I know there are other programs that are similar. So I think Megan Bang, she's an environmental educator, and she does a lot of these kinds of environmental summer camps with Indigenous youth.
Okay. All right. So this will be our last question. Did your team ever find the need to pivot ideas and goals during the project, either because of community input or better align with their needs?
I think so. One thing is really trying to figure out what that critical literacy. So what can we actually do when we're working with youth? And so it kind of seemed like it would be easy at first. I don't know why I thought it would be easy, but I did. But then we started thinking about, so like if we learn about how there's like livestock contaminating a spring, but we have 5th and 6th graders, are they going to be able to build the fence? Well, maybe not. And like, are people going to listen to kind of the messages that they have? And so I think that's kind of where we've expanded now, is where we're going to have the graduate students. So we're working with the workforce development at the tribal college. So they're going to know how to build a fence, and they can do this at the Springs. And so, but we can also involve the youth so they can be out there, they can hear about this, the building of the fence and the protecting the fence. They can actually see this action happening, and then maybe that can inspire them as well. I think just kind of having to focus in on E. coli, because there is a lot of different contaminants, but it's hard to cover a lot in just the time that we have. So we have really dived into more of that E. coli, because that's a test that the students can do.
Okay. Well, thank you so much for joining us from Montana and giving us the that Western perspective on things. So people just love your presentation. Just know that lots and lots of kudos in the chat. So thank you.
Yeah, thank you for having me.
Yeah, and so I'm going to invite my co-host Stan Hudson to come back. We've got a few minutes, Stan, to kind of just wrap things up for this year and offer some closing thoughts. Do you want to go first, or would you like me to go first?
I can go first, sure.
Okay.
Yeah, we want to thank everyone for attending today. And I know as Cynthia mentioned earlier, there's always great questions. And so, feel free to follow up with either us or any of the speakers with your questions, and we'll continue this conversation that we've started. As I mentioned, the recordings will be made available soon in the replay section of Ring Central, so you'll be able to see those. And then we'll send out an announcement when they're live for the public. So if you want to share these in a few months, then we'll be able to do that. I think that's about it. I really appreciate everyone coming in. And Cynthia, I'll hand it back over to you to sign us out.
Yeah, I was going to say, several people commented in Vanessa's presentation that they were inspired. But as I was thinking back over our day, this was a pretty positive story this year. I feel like all 4 of our sessions, and this is what this conference is designed to do, is to give, practitioners, people working in the field, working in various capacities, concrete ideas about how to make changes, various kinds of changes. And I feel like this year, all of our sessions really delivered on that. So I too feel inspired. Which, after doing this work for a long time, you need that inspiration from time to time. So I want to thank all of our presenters. I think all of our attendees for great questions all day, because I do feel like we're walking away from this year's conference with a lot of very feasible and practical things that we can work on until we get back together next year for the 8th Health Literacy in Action Conference.
Well,
go ahead.
I was just going to add that in between times, we can continue these conversations. I didn't want to take away from the Health Literacy in Action Conference, but tomorrow IHA will be letting everybody know about a new kind of revamp. So we'll have a brand new solution center that'll be easier to use and will help people connect so they can continue these conversations and maybe start some projects and things around the ideas that happened today. And then we'll also be launching the IHA Academy, which will include a certificate and many other professional development opportunities. So we're really excited about that. So look for that tomorrow in your email.
Okay. And of course, please do not forget about the conference evaluation that you will get. We really do look at the feedback. I know everyone says they look at their feedback. We really do. We really do. And we take those ideas and we use it for programming, both for the May conference that IHA does, and then for this joint conference that the Horowitz Center and IHA do for Health Literacy in Action. So please look out for that email. And as Stan said, we'll see you online at the Revamped Solution Center on the Health Literacy listserv, or we'll see you at next year's Health Literacy in Action Conference. Thank you, everyone.
Thank you, everyone.